Today's taping technique is using Kinesio tape, and we're going to tape to unload the AC joint. The AC joint is where the end of the collarbone, the clavicle, meets the acromion. Someone might have a sprain where they've overstretched the ligament, they've come down hard on the shoulder, that joint is inflamed but the ligaments are intact and it's still stable. Or they might have an injury where those ligaments that bind the end of the collarbone down have been partially or fully torn, and then you might see or feel a step deformity where the collarbone doesn't sit level with where the shoulder is. So there's two components to this type of taping. The first part of the taping is to lift the shoulder, the head of the humerus up into the socket so it's not pulling on that AC joint. And the second part is to unload the collarbone. So we need 3 pieces of tape. We're going to come down to where the deltoid inserts. You can see that little bit of a dip there. And we're going to cut our 3 pieces of tape. They're all equal length. We're rounding our edges so that the tape doesn't lift up. If we leave those sharp corners, then they will usually get caught on things, and once it starts to lift, you won't be able to stop it. So our first piece of tape, we're peeling the backing off to stick to the skin, and we're going to that end point of the deltoid, the insertion there, sticking it down so that we've got a good anchor, peeling it back almost to the end, and full stretch, so 100%, because we're aiming to lift that humerus up into the socket. So we're coming up, around, back down onto almost that medial border of the scapula there. Stick it down really well. Now we're going to do the posterior one, so we're sticking down next to it, and now we're coming behind the shoulder, again 100% lift, around the corner and over towards the front. And with the middle one, you're going to peel your backing off, midpoint, 100% stretch, literally over the center of the shoulder, and then we're going to go along that superior, the top edge of the scapula. So 100% lift all the way across, almost towards where the spine is. No stretch at the end. If you've got stretch all the way, the tape's probably going to lift. So we've got our first component done. Now we've got our 2 shorter strips for the AC joint support. Rounding the edges as always. So you're going to start at the front for this. You want to just feel for the end of the collarbone. If you're not sure where it is, you'll feel it through the front of the chest. Follow it along until you get to the bump. If they've got a more serious injury, you'll be able to actually see the bump quite clearly. We don't want to go right over the center of that bump, the end of the clavicle. We want to sit just to the inner side of it. So here's the bump here, the end of the clavicle. So I'm going to go just the other side. So just lay your tape down at the front of the chest. So you don't want to come down as far as the armpit. You do want to come up a bit higher. And with the end of the collarbone, you just want to push it down a little bit, especially if there's an obvious deformity. Full stretch as we go up and over. So if you don't stick your tape down properly, it will lift up as you just saw. So we're pulling down, coming over, and really get good stretch as you come over the back. And you're going to do another one to reinforce that. So I'm just going directly over the top just to reinforce. So sticking it down really well, end of the collarbone push down, bring your tape over, full stretch, so you're just onto the scapula there, and make sure you stick it down really well. And that is your AC joint taping using Kinesio tape.